The last time I was on for the rehab podcast, I brought up the idea that we're devaluing our profession with bad care. And I brought up a problem last time, which some of you probably didn't like, but I also wanted to bring up a solution. I'm not a big fan of just saying, okay, here's a problem, here's a problem, here's a problem, when we should be saying, okay, here's the problem, but what do we do about it? It's not really all that great to have problems without solutions. So the solution to this problem is multifaceted. It's a flood coming, and we need a lot of sandbags to stop that flood. This is one sandbag that I'm going to talk about today. It's a sandbag we've had in our arsenal for a long time, but we don't really use it. So it's just one sandbag, it's one part of the solution, but we need to look into it and address it, and I think it solves a lot of our problems. But if you look at bad care, and bad care comes from a lot of places. If you're a PT business owner, setting up your business poorly will lead to bad care. So think of, if you know you're only going to get $45 for 3-unit reimbursement, then why in the world do you have a 7,000 square foot space? You can't bring in enough revenue to support that space unless you see multiple patients at the same time. The only thing you can do is up your volume. You can't up your reimbursement, so you up your volume. Insurance regulations lead to bad care. If you have to fill out a bunch of forms and paperwork and jump through a bunch of hoops, you're going to get bad care over time. You have MBAs controlling medical care. Physicians controlling your practice because you need their referrals also leads to bad care. So these are some of the ways that bad care creeps into physical therapy practice. And all of this boils down to one big thing. PTs and the PT business owners feel like they lack control. So they blame their poor practice on others. They say, well, I practice poorly because of an insurance company. I practice poorly because of physicians. I practice poorly because of this. Or my level of care is this because of insurance. It's not my fault. It's the insurance company's fault. And that's just how it goes. So we have a tool. We have a very powerful tool, and it baffles me to why some of my colleagues are so reluctant to use it. And we'll talk about that tool after the intro. Don't go anywhere. Stop defending mediocrity in our profession. Welcome back, and thank you very much for joining me on the Dr. Krol PT and Fitness Podcast. I am your host, as always, Dr. Lee Krol, physical therapist, and today is more geared toward my colleagues in rehab, physical therapy in particular, but it is an interesting listen for the patients out there. So if you're a patient out there and you've had PT care, whether it's been good or bad, that's not the issue right now, you can listen to this podcast and it'll kind of pull the curtain back as to why maybe you were one of 4 patients being seen at the same time. Maybe why the PT put you off into the corner and let you do your own thing, and they really didn't spend much time with you. So this will kind of pull the curtain back as to why these things happen and why, as a patient, you shouldn't find this acceptable anyway. Just because there's reasons that the PTs do it this way doesn't mean they're good reasons, and it doesn't mean that it's somebody else's fault. So I hear all sorts of excuses from PTs as to why they treat the way they do. And it's a justification for that lower quality of care. So before I even get into that, I want to talk about what lower quality of care really means. So lower quality of care is really any one of these things. Seeing more than one patient at a time, that's lower quality of care. More volume, less quality. It's very simple. There's no justification of it. There's no bullshitting your way through it. If you see more patients at the same time, the quality of care goes down. Another one is cookie cutter exercise programs. If you come in with a shoulder impingement and they reach into the drawer, pull out the pre-printed sheet, here you go, here's what you do, or everybody gets the same thing for plantar fasciitis, or everybody gets the same thing for low back pain, that's a cookie cutter treatment. It has nothing to do with you as a patient. They didn't personalize it for you or your situation. They just gave you the exercises. That's lower quality of care. Again, there's no getting around it. There's no justifying it. It is what it is. Physicians telling the rehab specialist exactly what exercises to do. This is an awful practice, and this happens all the time. You get physicians who are not rehab specialists. They've never rehabbed anyone in their life, telling the rehab specialist how to do their job. And that drives me absolutely crazy. Physicians don't do it to any other specialist. I don't know why they do it to PTs, but it happens all the time. A physician doesn't refer out to a cardiologist who's a specialist and say, I want you to do exactly this, this, and this, and then refer them back to me and we'll see if it worked. No, they send them out to the cardiologist or the oncologist or the urologist and say, here's why I'm sending them to you. You do your thing and report back to me and see if we need to go in another direction. That's exactly what happens, and that's what should happen on the rehab side. But we'll get into the reasons behind that in a second. Physicians dictating who can and cannot see their patients. There's one little caveat to this: subspecialties. So if you're sending out to ABC Physical Therapy and they have a vestibular specialist or a lymphedema specialist, then yes, that person should be seeing the lymphedema or the vestibular specialist. But in a lot of cases, what happens is the physician just likes someone at that clinic or doesn't like someone at that clinic for whatever reason, and they say, oh, so-and-so can't see my patients, or I want this person seeing all my patients. It's complete garbage. That should not happen. Again, you put the expertise where it should be, which is in the hand of the rehabs people. Filling out useless forms or taking unnecessary measurements just to make sure you get paid. That's a common practice in PT. A lot of times you'll fill out an intake form, and then there'll be some sort of gauge or outcome measure that you'll get as a patient, and that will say, you know, what type of pain do you have doing this activity? How much does it hurt to do this? Do you have any pain doing that? And then the score gets added up, and then later on they check it. It's called an outcome measure, and what it's supposed to do is it's supposed to provide a measure to say, hey, are they getting better or not? Do we have a semi-objective way of saying that they're getting better or not? It's complete garbage. Goniometric measurements that are unnecessary, or other measurements that are unnecessary just to provide an objective measure to continue to get paid or to continue to get reimbursed. These are all types of bad care. Modalities being used just because the insurance carrier will pay for them. These are things like ultrasound or electric stim, heat and cold, anything like that, traction. So if you get electric stim every single time that you come in, you know what's really happening there? They'll pay for electric stim, and the therapist says, okay, I can put them on the e-stim. That'll take 15 minutes. I can go do something else, and I can go work with a different patient. So the e-stim is not because it's the best clinical treatment for you as a patient. The e-stim is being done to stack patients to see them at the same time. That's exactly what's happening there. So these all lead to bad practice. Any of these things that you heard, they're all bad practice. And again, there's no justifying it, there's no defending it, there's no anything like that. It's just, if you're a PT, just say, hey, this is bad practice. This is lowering the quality of our care, but we're doing it for these reasons. Great. So I hear all sorts of my colleagues defend the choice, and I use that word appropriately, the choice. You are choosing to lower your quality of care to increase your volume. And I hear all sorts of blaming. They blame physicians, they blame insurance carriers, or they say, well, that's just the way it is. That's the way it's always been. But the question I pose to you is it? Is that just the way it is? Do we have to do it this way? Does it have to be this way? So remember, my main point of all this is lowering our quality of care devalues our profession over time. And I've heard so many PTs over the years cry about, we need higher reimbursement. This needs to pay us more. These people need to pay us more. But let me ask you this. If we do worse work, if we lower the quality of our care and devalue what we do so much, what grounds do we have to stand on to ask for more reimbursement? I can tell you straight up, if I worked for an insurance company and I went into a clinic and saw 4 patients an hour being treated, the PT's filling out paperwork in the office, semi-supervising what's going on, I would actually pay us less money. We don't have a leg to stand on if we keep devaluing the quality of our care. So the really big point of this is we can't change what other people think. We can't change what other entities do. We can't change what happens with an insurance provider. If they're going to pay us less money, which is what's happening over the course of time, then we can't change that. The only thing we can change is ourselves. True change comes from within, not from outside. It's always from within. So look at it this way. No group in history, doesn't matter if we're talking sociology, doesn't matter if we're talking professional, doesn't matter if we're talking industry, no group in history has ever been given more respect than they give themselves. So you can sit there and blame other people. You can blame physicians, insurance providers, patients. You can blame all sorts of other things. But if you don't change what you're doing, then there's no reason for the patients, physicians, and insurance providers to see us in a different light. We have to change what we're doing. That's the only thing we can control anyway. We have to call out our own practice and say, okay, can we do a better job? And really, I talked about control earlier. A lot of PTs treat this way because they feel they don't have control. They don't have control of physicians. They don't have control of what insurance will reimburse them for. So we have to take back control. Control of our business, control of our practice. But how do we do that when physicians control our referral source? We have no choice but to do whatever they say, right? How do we control that when insurance providers make us jump through all these ridiculous hoops to get reimbursed? We have no choice but to jump through those hoops, right? Why don't we embrace the ability to create our own revenue stream? Why are we relying on physicians and insurance providers solely for our revenue stream? Why don't we embrace our own? Why don't we embrace direct access? This is something that drives me absolutely crazy. I don't understand why companies don't use this at all. They don't look into it. They don't focus on it. They don't put any time into it. They don't see the value of direct access. So let's go over a couple of different realms. Let's start with the physicians. So if you built your clinic and physicians provide your referral source, they are nearly 100% of your referral source. You get an occasional walk-in that you'll do a direct access, but not because you look for it, it just happens. So 98, 99+% is physician referral. So when they provide our referral source, when they are all of our money coming in, then when they tell us to do something absurd, like, quote, do these exercises, these 3 exercises with every patient with low back pain, that is absolutely absurd. It's absolutely crazy that a physician would tell us to do that. But they do it. And as a business owner, if that physician or that physician's group is 52 to 65% of your referrals, you're not going to tell them no. You're not going to risk the referral source. You're not going to risk losing it because it doesn't make any difference if they send it to your clinic or somebody else's. As long as they do what they want, they're just going to send them to whoever. They don't care. So you're not going to risk it as a business owner if you set up your business that way. When you rely on physician referral, you're not owned by them. You're not a POPS, but you're controlled by them. You're a physician-controlled physical therapy clinic. So it's really difficult when you take physician referrals like that if you don't have any other revenue stream. So if you start focusing on getting your own referrals via direct access and community outreach, you reduce the percentage of your business that is tied to a problematic physician. And again, a problematic physician is anyone that meddles in your business, anyone that tells you who can see who from your staff, or if the owner has to see this person because the physician knows the owner pretty well. They go skiing together, they go golfing together, they have dinner together, whatever, it doesn't matter. But the physician is then meddling in your business. And the physician is, if they're telling you what to do from a treatment standpoint, that's completely inappropriate. But again, if they control your business via referral, then what choice do you have, right? So if you start taking patients via direct access, now again, in New York State, you can see them for 30 days or 10 visits, whatever comes first. Now, if that happens, you are invariably going to be referring patients out to physicians. There's no way around it. So you're going to have someone come in. They're not going to be appropriate for physical therapy. You're going to know it within a visit or two if you're doing your job, because nothing magical happens at visit 15. Nothing magical happens at visit 8. You should know pretty quick if you can help this person or not. You're going to be referring out to physicians. So guess what starts to happen at that point? You become a referral source to them. They look at their business model and say, hey, this PT is accounting for 10% of our referrals, 5% of our referrals, 8% of our referrals. So you are now valuable to them. They now don't want to lose you because you're bringing them money. So if you level that playing field, so now you're bringing in direct access patients. Now 15, 20, 25, 30% of your intake is now your own. It's your direct access. It's your community outreach. You've done it. It doesn't rely on physicians anymore. Now the physician has a smaller cut of your business. And since you're referring to them, now you're almost on equal playing field with them. Now it's a lot easier to tell a physician to stay in their lane. Again, when I refer out to physicians, I never in a million years would refer out to a physician and say, okay, here's why I'm referring to you, and I want you to give them gabapentin, and I want you to do this injection. I would never do that, because the physician would look at that, and rightfully so, say, stay in your lane, PT. You referred them to me, thanks for that, but I'll do what treatment I find most appropriate. And they would be absolutely correct if I said that to them. You know, physicians don't refer out to oncologists and say, okay, I want you to do this type of scan, I want you to do that scan, and I want you to do proton beam treatment, I want you to do this. They don't do that. They send out to the oncologist and say, here's what I found, here's what's going on. You look into it, you're the expert, you're the specialist, just report back to me with what's going on. And that's exactly what should be happening. But if we rely solely on physician referral, then we can't ever level the playing field with the physicians. We have to bring in our own revenue stream. We have to be independent enough where we can tell a problematic physician, we're not interested. You know, you're not worth our irritation, or you need to stay in your lane. You can have that discussion when you're on level footing. You can't have it if you're not. So the next realm that people complain about all the time in PT is insurance providers. Oh, the insurance companies make us jump through hoops. The insurance companies make us do this. It's so much paperwork. It's so much this. It's so much that. Yeah, it is. And I say, what about them? You always have to jump through their hoops. Their hoops are always going to be there. But when you take direct access, especially when you couple it with cash payment or self-payment, you've eliminated those hoops completely. You have completely wiped them out. You don't have to worry about pre-authorizations. You don't have to worry about outcome measures. You don't have to worry about getting swamped with paperwork. You set the price, they pay the price, they come in, and you treat them with the highest level of care possible. Again, if they're paying cash and they're coming in direct access, you need to treat them with the absolute highest level. You can't just bring them in direct access and see 4 patients at the same time. That shit doesn't fly. And one of the reasons that people don't do direct access, honestly, because they're not good enough to do it. And deep down they know that I'm not really a good enough practitioner. I've been juggling patients for the last 8 years. I don't know how to treat one-on-one anymore. I don't know how to be held accountable to get people better in 2 to 3, 4 visits. So again, insurance companies are always going to have their hoops. But if you're taking your business and you're making less of it, an insurance provider business, you are freeing up your front office staff, or you don't need as much administrative staff. You don't need to hire 5 people in your front office anymore. Or your front office people aren't jumping through hoops all day long trying to get your therapists paid and trying to get the whole business paid. You're bringing in direct access people. Those administrative people can be doing community outreach instead, building your own revenue stream. Again, I talk about this all the time. You need to have your own independent revenue stream. And I don't understand. I don't understand why PTs don't explore this avenue. I don't get it. It's so simple. It takes time. It takes a lot of time. But my business, my whole business is built on direct access. My whole business is built on cash base. And it's not that I have any problem with insurance companies or people using insurance. It's just that I try to make things very simple. So I built my business on 3 pillars. Those 3 pillars are only see 1 patient at a time, treat the body as a whole, and never charge people money to do their home exercise program, un or semi-supervised. And I look at those 3 pillars. Anything that gets in the way of those 3 pillars, I just don't do it. So insurance companies, they tend to get in the way of that. They tend to make it difficult for you to do all that. I don't take insurance. I don't have a problem with it. If insurance made it simple to do those 3 things, I would take insurance. I'd have no problem with it. I don't do a lot of physician referrals because I find way too many physicians try to meddle in your business. They look at you as physician here, PT down here, when it should be physician referring out to a specialist, which is PT, cardiology, oncology, urology, etc. So when I have a physician that I have a good working relationship with, which I have several, then it works out fine. I have no problem with this. In fact, I had a conversation, about a 20-minute conversation with a pediatrician the other day about a patient that we had. called her up and said, Dr. So-and-so, this is Dr. Krol, PT. I'm calling you on behalf of this patient here. And we had a good conversation, a good back and forth, and talking about what's best for the patient, maybe where the patient needs to go after this. And that's the type of relationship you should have with a physician. That pediatrician in no way, shape, or form would have ever told me, well, do these 3 exercises with her and report back to me how it goes. She just said, what did you find? What are you seeing with this patient? And maybe do we need to go a different direction? And that's the conversation we had. And that's the conversation you can have when you have your own revenue stream, your own form of income, your own ability to keep your clinic going without having to rely on physician referral. Physician referral is fine, but if they are too much of your business, they will control you and they will meddle in your business. They will tell you what therapist needs to see what patient. They'll tell you what exercises to do. And if they're too much of your business, you're going to do it. It's just the way it is. And that unfortunately lowers patient care. And this always comes back to patient care. The quality of our work needs to go up. It needs to go up. I've talked to way too many people who say, yeah, I mean, PT doesn't really work. I mean, I can stretch on my own. I can look up exercises on my own. I can, play around with a band or a ball at home. That's what people think of PT. It doesn't matter if we like it or not. That's what people think of PT because we've seen this decline in our quality of care over time. And we can blame physicians, we can blame insurance companies, we can do all that stuff, but we have to take ownership of our profession. We have to take ownership of our businesses. Number one, we have to set our businesses up appropriately. If I'm selling fidget spinners, I'm not getting a 6,000 square foot space to do it in. I can't make any money, I can't pay the rent. If you're only getting if you're hell-bent on taking insurance and that's the route you want to go, you're only getting $45 for a 3-unit reimbursement in Western New York. Why are you renting this big space? Why do you own this big building? Why do you have this massive conference table and this massive conference room? What are you doing? There's no reason to size your business appropriately. If you size your business inappropriately, you forfeit the right to blame an insurance company. You sized it inappropriately. You can't blame them for doing bad work. You can't blame them for seeing 4 patients at a time. You sized your business inappropriately. Size it the right way, then you can pay your bills with what they reimburse you with. But if you don't take control and take ownership, get your own revenue stream, we fought hard for direct access. The APTA and all the states are fighting hard for direct access. Why don't we use it? It levels the playing field with physicians. It levels the playing field with insurance providers. It levels the playing field completely. We can use that as a tool to increase the quality of our care. But the caveat is, you have to be good enough to do it. And there's nothing special about me. The only thing that I do is I just treat people the way they're supposed to be treated. One-on-one, treat the body as a whole. Don't just have people come in and do their home exercise program. I never have someone who comes in, chief complaint of shoulder pain or shoulder dysfunction, talk about their hip, and I say, oh, I can't see you for your hip because I'm here, you're here for your shoulder. I never do that. The two are interrelated. The body works as a unit. We have to start treating at a higher level or we are going to be replaced. We're going to be automated out. We're going to have other professions snipe away at us, pick us apart, and eventually our profession is just going to die off. So we need to take ownership. We need to embrace the direct access privilege. We need to provide care at a higher quality. Enough defending mediocrity. Stop defending mediocre and low quality of care. If we do that, our profession is going to get better. Our profession is going to be more respected. But that change only comes from within. It doesn't come from the outside. We have to take ownership of our own problems in our profession, even if it's really uncomfortable. Even if you hate me for these last 25 minutes for calling our profession out, it doesn't matter. I'm okay if you don't like me for saying it, but the reality is we have to take ownership of our profession. We have to dump that old school mentality of, that's just the way it is, and, well, the physicians, they control us. They're our referral source. We need to cater to them and send them bottles of wine every year and take them out for dinner and kowtow to the physicians. We are specialists. We are doctoral level educated PTs. It's just the way it is. So we have to level the playing field, and the only way we can do that is by embracing this direct access privilege and becoming a referral source to the physician as much as they are to us. So again, thanks for taking the time and listening. I really appreciate it. I know this is hard to hear for some of my colleagues. I know they don't like this, but leave me some comments. I always like the feedback. I don't care if you agree with me. I want good, honest feedback, good, honest discussion. That's the only way our field gets any better. That's the only way our practices get better, is if we have good, honest discussion about this. It's not name calling. It's just when we have bad care, we have bad care. And when we devalue our profession, everybody suffers, including me. And honestly, the patients are the one who suffer the most, because then they just get sent to automated programs, or people don't even send them to PTs. I've had orthopedics just give people exercise sheets and say, yeah, just do this, don't worry about PT. And the exercises they gave them were complete garbage. So that's what people think about us, whether we like it or not. That's our perception in the public, which we will talk about going forward. So thanks for taking the time to listen. If you like what you heard, I want you to subscribe to the YouTube channel that this is posted on. I want you to hit that like. If you found it on social media, I want you to share it. I want you to talk about it. I want you to get this word out there and get as many people talking about this as possible. So, this is the Rehab Podcast. Dr. Krol PT signing off. I will see you next time. Stay there. Take care of it. Get our profession working the right way. And I will see you next time.